Thank you for the nice introduction. Now it's working. Hello, everybody. So I will give you a brief overview in this keynote. We've heard many interesting things over the last couple of days, and what I will try is to wrap up things by a very broad overview from my point of view that concerns AI in medicine, the progress that we're currently seeing, the perils we're still facing, and hopefully bring you a perspective, a broader view of what's currently happening in the field. And also I'll try to relate to some of the things that I've seen over the last couple of days in this really great conference. So let me first give you a very brief overview. I can't see that, but you can see it. Okay. So let me give you a very brief overview what my lab is doing. So first thing is we develop software infrastructure. What does that mean? Especially in medicine, there are always many researchers who don't genuinely write code, who don't know about infrastructure, who want to use the facilities that we have, but don't have the capability to host their own GPUs, who don't know what CUDA is, who don't know how to develop, optimize, and evaluate machine learning models. And that's one of the mainstays of what my group does, is provide this infrastructure at the university where I'm at. I'm not going to talk about these details. The second big thing, if you work in medicine, is of course how to close this gap between, on the one hand, models and developments that we see everywhere, and actual patient care. And for that, you need to focus on quality assurance and certification, because if you want to use things in the clinic, you need that certification. And of course, this focuses a lot on generalization, on model scope. So does a model actually work for those patients that we're seeing here, and not just in a benchmark or not just on the data set that we acquired in research, but does it actually work on the ward in this clinic? And there can be huge differences, obviously. And then we have to talk about bias, because especially in research and in machine learning in particular, the data you train with is the rules that you're going to get out of that machine. So if you only train on males between 20 and 30, as is very common in many kinds of medical research, you will have a huge bias when it comes to 70-year-old women, obviously. And the same is true for different aspects of patient groups and so on. And then, of course, we look at safety and security, especially in the days of large language models. We need to ask ourselves, how replicable